My name is Tracy Washington Inger, and I'm going to have the privilege of being your facilitator for the summit over the next couple of days. And in doing that, the first thing I want to do is express my thanks and appreciation to all of you for having me here. Because on the day after election, when so many of you have gone out to vote to send or resend people to Washington, D.C., you have given me an opportunity to get out of Washington, D.C., and be in the great state of Texas. So when I am in Washington, D.C., and one of the great things about working in D.C. is you get to say, I'm here from D.C. and I'm here to help, right? And it never fails to get a laugh. But in this case, it really is true. Here from DC, and in my day job, what I do is I work for the federal government and I work as an environmental health protection specialist. And what that means is I get the opportunity to go out into communities and to help them get into action to better protect themselves from environmental threats, to help protect their health, and to engage with one another in a way that creates transformative change. Now, having said all of that, it was not my dream as a little girl to be a government bureaucrat. You know, I did not grow up playing with my little bureaucrat Barbie. It wasn't like that, right? It wasn't like that. So I went to school, was a journalism major. Actually, my plan was to be Mary Tyler Moore. So I went to journalism school. I was actually an advertising major. And the plan then became that I would go into advertising and make pots of money. Move to New York, start my own advertising agency, and make even bigger pots of money, right? That was the dream. But a funny thing happened on the way to Madison Avenue. I went to Peace Corps. And while in Peace Corps, I grew a sense of service and a sense of commitment to the communities that I was serving there. And everything changed. Everything changed. And so that was my introduction into being a civil servant, was working in communities. And what I learned, everything that I've learned about working in communities, everything that I've learned about creating great transformational change in communities, I learned there. And the key thing that I learned was that communities everywhere, all over the world, have the brilliance and the resilience to solve their own issues their own way, to their own best advantage, given a certain set of resources and support. They can do it. They can do it. But that certain set of resources and support is important because communities everywhere, no matter where they are, in Africa, in Latin America, in Asia, in San Antonio, in DC, wherever they are, they all really want the same things. They want to make sure that everyone in their community has their basic needs met and maybe just a little bit more. They want to make sure that their children have an opportunity to have a better life than they had. And they want to do that in the security of good health and well-being. They all want the same thing. It doesn't sound like very much, does it? But it's not happening in every community. It's not happening in every community in Sierra Leone where I served. It's not happening in every community in San Antonio, certainly not every community in DC. And why is that? The good news here is that those tools and resources that we need to make those resilient communities who can take ownership of their own health, we know what they are. And they are the pillars and the building blocks of our host organization here today. They are the building blocks of the Immunization Partnership. They are education and outreach. They are teaching and reaching everyone in the community. The pillars are based on advocacy, standing up for one another, standing up for the principles and the practices that we know create change. And it is finding those practices and spreading them with as much immediacy and as much efficiency as we can. It is education and outreach, it is best practices, it is advocacy. Those are the tools that when we provide them to communities, They can solve their own problems, address their own issues, protect their own health. In this organization, the kind of leadership that's necessary to bring that kind of transformative health change is embodied in my friend Anna Drasbeck. So Anna was also a Peace Corps volunteer in Sierra Leone, and before we really knew it, from the first day that I met her, she was a public health advocate. That wasn't her title, wasn't what she was recruited to do, but that is who she is. That's because it's not what she does, it's kind of who she is. So when you talk about education and outreach, reaching and teaching people where they are, I used to hate when Anna would come visit my village. I love when you would come visit my village, but I hated it because after Anna was there, the people in my village wanted a volunteer exchange. Okay? They were ready to trade me in for her because they couldn't understand, why can't you speak the language like Miss Anna can? Why don't you know the things Miss Anna does? And she would. She spoke the language better than I did. She could connect in a way that very few of us could. One of the most vivid memories that I have of her in terms of advocacy, while we were embedded in the village, there was also expected to be a sort of certain distance, to be in it but not always completely of it. Well, she just blew that all away. All of the walls came down. And one of the most vivid pictures that I have of her in my mind is showing up in the middle of the night in our regional capital with a desperately ill child and the child's mother on her little motorcycle, because she had to get them to the regional hospital in order for this child to be treated. It's that kind of advocacy that we're talking about here. And in working in the rural hospital in Sarabu and working in the refugee camps after Sierra Leone took the terrible dive that it did, she saw what was working. That's what best practices are about, finding what's working and accelerating the spread of it. And that's what she did there. And that laid the foundation for the woman who is now the president and CEO of the Immunization Partnership. It is with those skills, it is with that passion, it is with that leadership and commitment that she brings what she has learned about transformative health change to communities in order to create communities that are battling to ensure their health and that are combating vaccine-preventable disease. It is my pleasure, it is my great joy, it is with deep respect and abiding awe that I ask you to welcome an inspired leader and my dearest friend, Anna Drasbeck.
Wow, that's a lot to live up to. Tracy, thank you so much. Back at you. And please don't give her any more wine because she might start telling the other stories that I probably don't want you to hear. Thank you so much. That was a lovely introduction. Wow. These lights are bright, but I can see that we have a very full house, and I know that the rain is keeping some people away, and I'm just grateful to all of you who are here tonight. So as Tracy said, it is my distinct honor and privilege to serve as the president and CEO of the Immunization Partnership. As Tracy also mentioned, our mission is to eradicate vaccine-preventable diseases through educating the community, advocating for evidence-based best practices in public policy, and supporting the best practices that create strong immunization systems. On behalf of the board and staff of the Immunization Partnership, I am delighted to welcome you here tonight. This summit is the biggest and best summit we have ever had. We have over 400 people registered. We have world-class speakers and some truly impactful personal stories. The next 2 days are going to be very informative, and it is our hope that it will galvanize partnerships and lead to strengthened immunization rates across our great state. And because information without entertainment is just pure torture, We have a lot of fun in store for you, so strap on your helmets and get ready for takeoff. The next 2 days are going to be more fun than you ever thought possible at a conference about immunization. Those of you with Twitter accounts, now would be the time to start tweeting. The hashtag is TXIZ14, Texas Immunization 14. So, while this conference hopefully looks seamless to all of you, it represents a huge effort on the part of a multitude of partners. First, I would like to thank our sponsors, and if you look at the back of your program, you will see a list of all the sponsors who stepped up to the plate. The price you paid for admission today is not nearly what it actually costs us to put this event on. And it is because of the generosity of these sponsors that we were able to keep prices low and offer you some truly inspired speakers and, if I may say so, some really awesome red wine. So I'd like to particularly thank our protector sponsors, St. David's Foundation. I know Becky is here. You're going to hear from Becky tomorrow. HEB and the Spirit Golf Association were all came in at the protector level. The inoculator level was Abel Hanger, Bexar County Family Services, San Antonio Metro Health, and at the eradicator level, CHI St. Luke's. So thank you so much to all of our sponsors. Let's give them a round of applause. I would also like to express my sincere gratitude to the staff and leadership of the San Antonio Metro Health Department. They welcomed us into their community and really helped us find a lot of people to help. They provided volunteers, they provided moral support, they provided marketing services. So thank you, San Antonio Metro Health. I would also like to thank a very special group of ladies who go above and beyond every day in service of the cause. Standing right over here at your service is the staff of the Immunization Partnership. Ladies, give a big wave. Not only do we have the smartest, hardest working staff in the state, I would say they're also probably the best looking. I think you would agree with me. I especially want to recognize Robin Carlisle, who went above and beyond in planning this event. Robin, all those emails you got, all that communication that happened, that was Robin. Anything of excellence that you experience over the next 2 days, it was Robin. It was all because of Robin, so thank you. I also want to recognize our really awesome steering committee who have been hard at work planning this event for a whole year. If you are part of the steering committee, please stand so that we can appreciate you. Come on, steering committee, don't be shy, stand. Thank you. Thank you so much. There's a list in your program of our steering committee members. I would also like to thank our volunteers, particularly the ones who are helping us with traffic control. No event like this comes off without a lot of volunteers. And so if you see somebody with a volunteer thing on their badge, please say thank you. If volunteers, if you want to stand or wave your hand, thank you so much for all your hard work. I also want to thank our mariachi band. That was the Southwest High School Mariachi Band. Weren't they awesome? We ordered extra food for them, so I hope that they took advantage of it because we know what high school students are like. They're actually the state champions, and you could see why from the awesome work that they did. I especially want to send a special thank you to my friend Tracy. As she said, our friendship started decades ago as Peace Corps volunteers in Sierra Leone, and it's survived all of the tragedies and triumphs that life can throw to a person over the course of decades. I'm really excited to share Tracy with all of my Texas community because I'm sure you'll find her just as magnetic as I do. So I'm thrilled to have you here tonight, Tracy. So the last few months have been filled with news of Ebola, especially since the first case in the US was right here in Texas. While Ebola is a very scary disease and not to be taken lightly, There are far more serious and scarier threats to our public health that don't receive nearly the same attention. These threats are far more important to the health and welfare of Texas than Ebola. So let's talk about what some of those threats are. First and foremost, since this is flu season, influenza is a major threat to the health and welfare of Texas. Last year, we had 20 pediatric deaths in Texas due to influenza. The flu shot is widely available, of course, in the clinics and workplaces, churches. I'm sure that many of you here tonight have given thousands of flu shots. If we counted up the number of flu shots given by people in this room, it would be staggering. Yet in Texas, only 1 in 3 young adults who are most likely to have small children in their home were immunized against influenza last season. Children did not die from a rare infectious disease, but from a vaccine-preventable disease that we did not protect them from. Pertussis is another threat, also known as whooping cough. Last year in Texas, we had 3,985 cases of pertussis, more than any other state in the U.S. This disease is particularly dangerous for infants, which is why the vaccine is recommended for pregnant women and caregivers. Yet only about 1 in 4 adults who live with infants have been immunized against pertussis. Another threat, neglected tropical diseases. Chagas, chikungunya, dengue, and other neglected tropical diseases are all circulating in Texas at rates much, much higher than Ebola. Several of these diseases have long-term side effects, even heart defects. Yet despite the potentially devastating impact of neglected tropical diseases, doctors don't always diagnose them properly, and many cases go unreported due to inadequate surveillance and lack of funding for vaccine development. Another threat, measles. So far this year, 595 cases of measles have been reported nationally, as many as the previous 5 years combined, and the highest number in 20 years. Thank you. Now over 600 cases. Texas has seen its share of cases with outbreaks in Tarrant County and scattered cases across the rest of the state. Unlike Ebola, measles is an airborne disease and is highly contagious. Simply being in the same room with someone who has measles can, and almost always does, cause an unvaccinated person to be infected. A highly effective vaccine nearly eradicated the disease, but it has recently made a comeback due to the surge in children who are not fully immunized. Which leads me to the final major public health threat that we're facing, and that is vaccine refusal. Texas allows parents to opt out of vaccines for their children based on personal beliefs. This means that your child could be in school with an unvaccinated child who would present a significant risk of spreading diseases like measles, chickenpox, meningitis, or some other vaccine-preventable disease if there were an outbreak. In 2012 to 2013, nearly 30,000 children in Texas schools were unvaccinated, most of them for non-medical reasons. But due to regulations about how data are collected and stored, Texas parents don't have access to that information. The parents of a child with an immune-suppressing illness have rights too. The virus of vaccine refusal is based in pseudoscience, but it is spreading every day in Texas, and we are poised for a preventable tragedy. So what are we going to do about these threats and others that might be on the horizon? Well, that is what we're going to spend the next 2 days talking about. Education, advocacy, and support of best practices will advance our mission, but it will take a concerted effort on the part of everyone here and hundreds of other people across the state to address these issues. That is why we are so honored, humbled, and incredibly excited to have so many community leaders in attendance tonight. First, I would like to introduce Dr. Schlenker, Director of the San Antonio Metro Health Department, who I first met about a month after he arrived in Texas back in 2011. Because he is an infectious disease physician, he has a passion for vaccine-preventable diseases. He called my office one day about a month after he arrived, and we started a dialogue that day to explore how TIP could be of help to support his great work in San Antonio. I am very, very proud to announce today that conversation that we started back in 2011 has resulted in the establishment of the first of the first chapter of TIP outside of Houston to be opened. We're going to be launching this office next spring, and we will enthusiastically support and amplify the efforts of Dr. Schlenker and his staff to strengthen immunization delivery in the awesome city of San Antonio. I would like to welcome Dr. Schlenker to the stage so that he can welcome all of you to San Antonio.
Thank you very much, Anna, and welcome everybody. It's just so joyful for us to have 400 plus folks dedicated to immunizations coming together here in San Antonio. We're very, very proud of that, and wish that we could have provided you some better weather, because really this is not what San Antonio is usually like, but hopefully it will clear up. And we hope that you enjoy yourselves while you're here, but also realize that every person in this room is dedicated to some very, very serious business. And like Anna said towards the end of her talk, vaccine refusal is one of the most serious challenges we face, but I think it even goes beyond that. There is really a science refusal that is so prevalent in our society nowadays, and we see that in the debates around climate change. We see that most recently in Ebola, when everybody kind of stepped into the breach and started making health policy decisions, most prominently the governor of New Jersey, who confined against her will the wonderful nurse who was returning from West Africa, and held her in a tent with a portable toilet for 4 days for no good reason at all. And fortunately, I think for all of us, she did not take it sitting down at all. And in fact, she's one of the most articulate public health voices that I have heard in recent times, really laying out clearly what science tells us and the correct way to make decisions for people and about people, and how that works in a democratic society. And really, I think everybody in this room does that same kind of thing every day. There is no debate about the tremendous good that vaccines have done the world in the last 100 years or so. The science is very clear, the results, the outcomes are very clear, and sometimes it gets frustrating because we repeat that over and over again every day. And it's true that some people actually prefer fantasy to reality, and that may never change, but those of us in this room, I think, are dedicated to the world as it actually exists, to science, to empirical knowledge, and communicating that on a daily basis. And ultimately, we will win, even when it seems dark, as sometimes it does. But on a more local note here, I would say that we're just thrilled to have you all here, and even more thrilled that the Texas Immunization Project is colonizing us. From Houston, they are moving to San Antonio. They are giving us a great big shot in the arm that we really look forward to. It's been great to work with Anna and her staff and see the wonderful program that they've developed in Houston. We want to do the same thing here in San Antonio, which, like Houston, is a big, growing, vibrant, changing everyday community that challenges us to embrace the change, but to guide it in the direction that will really help people and make it a better, healthier, safer community for everybody. And I'd especially like to thank my own immunization staff. Many of them are here tonight and will be here over the next couple of days. The leader of our Communicable Disease Division, Dr. Anil Mangla, who's sitting somewhere out in the audience, who has been a great proponent of immunizations for years now. And I'd also like to mention the new manager of our immunization program, Kenya Wilson, who's not here tonight and probably won't be here tomorrow because she's staying up until all hours to get the final reports into the CDC, which unfortunately is necessary to do this last-minute tinkering, because she just took over the program a month ago and there's a lot to be done. But she's an example of almost a heroic effort that people, many of you, do every day to keep our society moving forward in this regard. So again, welcome. Please enjoy your time here in the city and come back and visit whenever you have the opportunity. We really appreciate the wonderful and important work you're all doing. Thank you.
As I mentioned earlier, it takes a concerted effort on behalf of the medical community, the public health community, and the policymakers to sustain high immunization rates. Without strong laws supporting immunization, our state will not be able to protect its citizens from numerous vaccine-preventable diseases. San Antonio is fortunate to have representation in the Texas Senate by Senator Uresti, who wanted to be here tonight, who may still be able to arrive, but I believe has been delayed by the weather. So I ask your forgiveness in advance. If and when Senator Uresti is able to make it, we'll break into our program at that time and allow him to welcome you himself. The impact of strong laws and policies to support immunization rates cannot be understated. Immunization laws and policies make a tremendous difference in protecting the community from vaccine-preventable diseases, but this could be either positively or negatively. And unlike many issues today, immunization is not a partisan issue. Both Republicans and Democrats want to protect the communities, and we have had tremendous success with working with both parties to ensure that the community is protected. Tonight, we are honoring two members of the House of Representatives, Donna Howard and Representative J.D. Sheffield. They've both gone the extra mile for immunizations, waging a successful campaign in the House to ensure that the state immunization registry is efficient and a strong tool for healthcare providers. It is not a coincidence that both of them are healthcare professionals, and I just want all of you here tonight to know that you are well represented in the Texas House by these two amazing legislators. Representative Donna Howard has been a champion for immunization for the past 3 sessions, carrying many bills that support a strong immunization delivery system. I can tell you from personal experience that Donna gets it. She really does. As a nurse, she understands the science and importance of vaccines and does not shy away from the hard issues that are going to truly make a difference. Representative Howard, thank you for all that you have done for immunizations during your time in the House of Representatives. We look forward to many more sessions of partnering with you as our champion. Thank you. Oh, we have to do
Oh, picture, let me put this down. Sorry.
one picture.
There we go. Oh, it's spelling.
Thank you.
Thank you, Anna, and thank you all of you who are here. I am sorry that my colleague, Dr. Sheffield, could not be here. I know he tried and got caught up in the traffic and the weather as well. He was a wonderful asset this last session. Dr. Sheffield came in as a freshman legislator and just hit the ground running with me on this issue, and I can't thank him enough, and I appreciate y'all recognizing him as well today. We did get the opt-out legislation through the House last session. Hallelujah. Unfortunately, though, there is a downside to that because we could not get it brought up on the Senate side. There are still challenges to this, and I really appreciated the comments from Dr. Schlenker that just spoke. Some of the things that I would like to be able to say as well, that we do have challenges in the legislature in regard to evidence-based legislation. As weird as that is, I mean, to me, it's like a no-brainer. You have facts, you have evidence to support things. Why would you not have policies put into place that support that evidence? But that's not how politics works. And so we have a lot of challenges. Mentioned global warming. We've had issues with women's health care where we had medical communities come and talk to us about the science of what's really involved here. Didn't matter. We still had ideology and politics trump sound public policy. And I'll tell you, this is not Democrat or Republican, as Anna was saying. This crosses the whole spectrum. And I have many colleagues in the House, both Democrats and Republicans, who do recognize sound public policy and want us to work together to make that happen. The reality of our legislative process is that that just doesn't always happen. I have no art skills whatsoever, but I one day got so frustrated in my office, I drew this little rudimentary map of Texas, circle around it, line crossing through it, saying, "Welcome to Texas, a no science state." And I put that up on my bulletin board. It's like, I really am baffled by this. I am baffled by this, but luckily there are groups like this group, and there are people like you who are out there making sure that people like me and my colleagues get the information we need, and eventually, hopefully, it will sink in. You know, we have a part-time legislature, and we only meet every other year, although we have a bunch of interim hearings going on, but we only meet every other year. And we come, in the House, we have 150 members, the Senate, 31 members from all across the state, all walks of life. We come in with our own personal experiences, our own knowledge of certain areas, and, you know, there's only so much we can know. And when we come to the legislative session every other year, we vote on thousands of bills, and thousands of amendments to those bills. We need people like you who will help us get the information we need so that when we punch those buttons on the House floor or the Senate floor, we're making the best decision for our constituents and for our state. You have been there. Anna has been there. All the people that work with this great organization, the Emmets have been there time and time again. It is so vitally important, and I can't thank you enough for all that you have done and all that we're going to continue to ask you to do over the upcoming sessions to make sure that we do make the right decisions. So I know that Anna talked about some things a while ago where she actually mentioned some information that was in a Trib talk that she did. I think that's another important thing to recognize, that this organization is out there, the face of all of you, and is they're the go-to people for the information we need. What she mentioned in the Trib talk that I just looked at again that reminded me is the real threat is complacency and disregard for scientific evidence. That's the real threat we face here. Again, you are so critically important in helping us break through that, in helping us make sure that we're not reacting out of fear, that we're not reacting out of politics, but that we're reacting from a base of solid information and good public health policy that will actually protect the lives of Texans. So I thank you for recognizing me and my colleague, Dr. Sheffield. We will be back in January, hopefully making some greater headway in the legislation that we need to put into place, and we look forward to working with all of you. Thank you so much.
Thank you so much, Representative Howard. As Representative Howard mentioned, Dr. Sheffield unfortunately was unable to make it. He got caught. If anybody came down from Austin, I understand there was a crane that got overturned. So poor Representative Sheffield got caught behind that. So we will be making arrangements with him to give him his award later in the session. So next, I would like to recognize two people who have been instrumental in the development and growth of the Immunization Partnership. Judge Ed Emmett is the Harris County judge and has been a spokesperson, mentor, and advocate for immunizations for the last 5 years. He has worked publicly and behind the scenes on multiple immunization issues that affect the entire state, not just Harris County. But with all he has accomplished, I am here to share a little secret with you. I know the secret sauce of his success. I know this because Tip is fortunate to share that same secret sauce. What secret sauce do we have in common? Gwen Emmett. Gwen has been a devoted and active board member for the past 5 years and is our current board chair. Gwen gives generously of her time, talent, and wisdom to make Harris County and Texas a better place to live and raise a family. Her community commitments are many, and that makes us even more grateful that she chooses to spend her time working on immunizations. I would like to welcome the dynamic duo of Judge and Gwen Emmett to the stage to welcome you to the summit on behalf of the board and introduce our esteemed panelists.
Well, good evening. I come with greetings from our board in Houston. We are always excited about these summits, and this 5th summit of the Immunization Partnership is doubly exciting for all of us because we are going to stay here and have wonderful people here in San Antonio to help us with our hard work. We as a board are very concerned that the state of Texas be able to grow in our ability to do the advocacy that needs to happen statewide. We have Harris County, but Harris County is kind of an odd duck, the rest of the state, and we need to be able to present what all the counties in Texas need and make sure that we're serving all of our people. So San Antonio, yay. We got you on board, and hopefully we can just repeat that many times. When Ed became judge 100 billion years ago, where are you? There he is. It got real clear to both of us how important indigent healthcare was, and I quickly distilled that I wanted to be a part of things that were preventive. It just made good sense to me that if we dealt with things at the beginning, it wasn't going to be so complicated or so costly on the other end. And when I was approached about this group, it just seemed like a fabulous place for me to start. So for my work that I do, I am able to focus on things like this, hoping that we can make big difference for our residents and have their lives have a better quality and just a lot safer lives because of the things we do, like good immunization policy. There's a personal reason why I think this is it's important too. Ed and I have raised 4 children. We now have 11 grandchildren and 1 on the way. And you can bet that all the grandparents and all the parents and all the child care people all get their Tdap. They just know that's going to happen. And our babies are well and happy, and they get all of their immunizations. And frankly, I just don't get it, of why people don't see the importance of this. So this is an exciting way for us to be personally involved in things that we care about, and hopefully make some difference in the way the public goes. So thank you for being here, and I hope that you learn a lot and come away from this even more inspired. Thank you so much.
Well, good evening. I want it noted that Anna is the one who called Gwen saucy. I have done that over the years, but I don't get away with it, Anna, so I'm glad you did. I'm Ed Emmett. I'm Harris County Judge, and since all of you are from Texas, or most of you, a couple of you aren't, you understand that I'm not a real judge. County judge would be county executive anywhere else, but I do preside over the commissioner's court, but it's not a court. It's a Texas kind of thing, and if you're from Texas, you understand that. But in the role of county judge, I'm the Director of Homeland Security and Emergency Management for a county that is larger than 24 states in terms of population. So as Gwen mentioned, we see a lot of things when it comes to health care. And it is a little bit baffling to me when, for example, Hurricane Ike bore down upon the coast. I could go on television and I could say, people, you need to evacuate. You need to, and I use the phrase hunker down, which is now sort of taken on a life of its own. And they actually listened. And so as a result, we made it through that hurricane just fine. So it's baffling to me when we have diseases bearing down on us, when professionals who are the experts tell people what they need to do, they will listen to somebody on Facebook and say, oh no, that's not right. We don't need to do that. It is frustrating. And Representative Howard, since I served 4 terms in the Texas House, I fully understand everything you see in society in terms of really smart people and really ignorant people, they're all in the legislature. And it moves from issue to issue. So you can't count on, one being smart on everything. So it does change. But, and one other thing I have to say before I introduce our speakers, and I understand that you're about to see a movie, and we're kind of like the previews. When you go to a movie, you just wish the previews would get over with so you could get to the movie, and I'm getting there. But the whole Ebola situation, you will notice that virtually nothing has been said in Harris County. I can't tell you how many times, almost every day, somebody says, you really ought to go have a press conference and you really ought to be talking about it. And I'm going, no. Because as was pointed out, what we really ought to be talking about is flu. What we really ought to be talking about is pertussis and measles. And I'm not a doctor and I'm not in the realm of science, but I started using an example that cost people. We had certain leaders from this state, by the way, not Governor Christie, but from our own state, who wanted to talk about travel bans and this and that. And Dr. Bobby Robbins, who is the head of the Texas Medical Center, used a statistic that I have pirated. And it was that at that time, the Ebola outbreak in West Africa had been going pretty strong for 10 or 11 months. During that time, how many flights had there been from West Africa to Europe? Thousands and thousands. How many cases of Ebola had there been in Europe? 1. So we're going to change the whole commerce of the world based on something that's non-existent. And when you tell people that, they go, oh, yeah, that's logical. Well, what we've got to be able to tell people about immunizations has to be seen as logical. And you have a real privilege tonight because you have 2 people here and you're about to see a film that will help in that process, because it's important to have what I would refer to as sane, rational people talking about this subject. You're never going to convince everybody, but you have to convince the vast majority.